Good evening, doctors. Welcome to the session 6 of RRR Refine, Revise, and Reinforce. Why I am telling refine first? Because I hope so that you have already revised and now we are going to enter into refining our content, whatever we have read. By this time, according to original plan, you were supposed to finish the core medicine, surgery, pediatrics, and OBG from your notebook, from your workbook, what I have shared with you guys, and ticked all the large number of green boxes whichever there in your workbook and entered January with a clear runway towards your march. But let's be honest. How many of you have completed it? How many of you were in the track? Many of you were partly on the track, of course, yes. But 70% of you thinking, sir, the timetable looked beautiful in December when you first shared with us, but it has really hit us hard in January. If that is you, today's session is exclusively for you guys. Today, it's not about being guilt. It is about the diagnosis and rescue, diagnosis of where we are and management of what we are going to go ahead. If you are going to stand in the midway telling that, sir, I don't know where to go, how to start with, I have a huge chunk of syllabus with me now. I thought to follow your schedule, but I couldn't follow it. I've just followed half of it. Then this is your session. By the end of the session today, you are going to get a clear understanding of where you are and where you are falling behind without labeling yourself as lazy, without laying yourself as useless. Nothing, no labels required. Every one of you, 70% of you are standing in the same exact place. And version 2 plan, we are going to discuss that fits on your real life, postings, fatigue, and your current position. And rescue timetable from now on till your mid-February so that you still peak in your March. This is going to be a reset and rescue session. If you are a person who had followed the timetable very well, very good, you follow the remaining timetable and move towards the refining part. If you are a person who haven't followed the timetable yet, don't worry. Follow your OFTEL, ENT, and minor subjects from today, from tomorrow, as per the executing schedule. And then after the end of that, follow the today's timetable. That is your reset timetable, which I have prepared for you guys. So let's first understand why so many of you fell down. Why so many of you haven't followed the pattern which we have discussed earlier. Common problem is on the day one I told you, it is your dominoes effect. You missed 1 or 2 days due to your posting, due to your illness, due to your mood, and you thought, okay, I'll do 2 days portion in the one day. And then you became tired, you failed, and you became exhausted. Then backlog sat there. Day one unpaid, day two unpaid. By day seven, you owed day five. 5 days, you couldn't catch up. So you dropped the timetable entirely. This is the dominoes effect I told you on day one. And most of you fell into it. And second common pattern which I observed after discussing with you all individually is perfectionism. You thought that I will master entire subject perfectly. You spend 6 to 8 hours on it daily. You wrote perfect notes. You watched the entire video in all the apps. You understood every mechanism. By the end, you are done with the topic one perfectly. When the workbook is said, you need to finish 8 topics that day. You sat with one topic. You thought that you will go into depth into 10 subjects, 10 topics, but then at the end, you didn't cover 50 topics which you should have actually done. And energy mismatch. Of course, the timetable assumed you had 6 to 7 quality study hours. Real life gave you 3 to 4 hours only. I got a message from one person saying that, sir, my relative got ill and I was looking after them. I got barely 3 to 4 hours. I couldn't study fully. Yes. So every one of us may have problem with the posting, commuting, fatigability, and also your exams, mock exams, which the exams conducted by the college. So every day you looked at the plan and felt, I can't finish the target today. And by 4 p.m., you had only covered off. Guilt set in. 6 o'clock, you gave up. The problem was not that you are not capable. The problem is mismatch between your plan and reality. And of course, emotional drag. Some of you were fine with the content, but your mind was struggling. Anxiety from the session 3 crept in. Fear, comparison, guilt. Your brain was foggy. Studying felt like pushing a border uplift. You started to doom scrolling late at night, poor sleep pattern. You didn't have a mental breakdown. You just couldn't follow the steady plan. That's all. And finally, micro plans you don't have. You saw the workbook, day 12, pediatrics. You thought pediatrics must be done today, but you didn't break into 3 to 4 realistic block. Cardiology and respiratory medicine in pediatrics, GIT in pediatrics, neurology in pediatrics, emergency protocols. You didn't divide like that. And at 3 p.m., you would have done block 1. At 5 p.m., you would have done block 2. By evening, you felt defeated. Sir, I couldn't do anything, so I gave up. The truth about version 1, if you see, the truth about version 1 is, here, I want to say out to you very clearly, problem is not that you are not capable of. The problem is that version 1 of plan did not match your real constraints. You are not lazy. You are not weak. You are a human. December, you made a plan with limited informations about postings, energy levels, and mental state. It was beautiful on paper, but in reality, many failed. So now we will build a version 2. The version 2, let's make it very realistic. The version 2 of refine. Okay, refine pattern. Let's make it very realistic. So now on, you are going to try to follow the version 2 after completing the minor subjects and your ENT and Ophthalm. Clear? Yes. So what we are going to do? We design a rescue timetable. We will name it as a version 2. We must reframe on how you think about being behind. Here's what you're probably telling yourself right now. Right now, you're telling that because I am not fully on track, nothing matters. I have already blown it. Why bother trying a version 2? I'm not going to get through this. This is how your mind thinks, isn't it? Stop that. That is all or nothing thinking from session 3, right? It is a trap. Let me reframe it for you. Let me reframe it. Forgive December. December, you made the best plan possible with the information you had. You didn't know how your posting will go. You didn't know how your mental energy will be dipping down. And you don't know when you get fully sick or when you will have a family drama, when you have a relationship issues. We don't know anything. So December, you did the best what you can. So forgive that version of you. You don't have to be guilt. You deserve a new plan. And that's why I'm here. Okay. And accept that January needs different design. That's all. Your January needs different design. Repeat along with me. Your January needs different plan, different design. And the goal is not changed. Passing with strong performance in March is our goal. But we are just changing the route in the next part of our revise. After revise, we are going to refine it. That's why I termed it as refine, isn't it? So you're going to refine your thinking. That's all. Okay, a timetable that assumes 6 to 7 hours per day does not work when you have just 3 to 4 hours. A timetable that assumes no posting does not work because you had a posting that time. A timetable that assumes perfect emotional state does not work because you're anxious now. So we redesign it. Not because you have failed, but because the plan failed. So now we will move into the next one. We will drop the fantasy of catching up perfectly. We will give a live audit, because that fantasy of thinking like I will do all the missed work plus stay on the schedule, I will catch up perfectly, that is not going to work here. You cannot catch up perfectly and don't need to do it also. You need to prioritize now, compress it and rescue. Compress it and rescue. Think like a surgeon in an emergency room. You don't have time to fix every problem in emergency room, isn't it? You want to stabilize the patient. You want to make the patient out of critical condition. You do damage control and patient survives and can recover later. Exam is like a damage control. Your job is not perfection. Your job is a survival and strategic recovery. So now we move into an honest audit. I want you all to do it right now with me. Take your workbook. Open medicine, surgery, pediatrics, OBG. I want you to do it right now. You all have your workbook, isn't it, with you? You all have your workbook, isn't it, with you? Guys, you all have your workbook, isn't it, with you? So I want you to do it right now along with me. Along with me, do it right now. Open that. Open your timetable which you have. So in the timetable, okay, in the timetable, what you're going to do is, you're going to do it along with me, guys. Okay, so you take the timetable, medicine, surgery, pediatrics, OBG, you take the timetable. Now, what you're going to do is, if you have different color pen, fine. Otherwise, write it as green, yellow, red. Okay, if you have a marker, you can just mark it down, or else write it green, yellow, red. You're going to color it. Green is for done reasonably well. It is staying in your brain. You read it, you answered it, you did at least one active recall. It is not perfect, but it is in your brain. Yellow is like partially, you have skimmed through it, but you could never actively recall. Like I told you in the previous mentorship session, it is on the surface of your brain, and red is something you didn't touch at all. So what you're going to do, you're going to take my workbook. In the workbook, mark it with green, red and yellow. Okay, mark it with 3 different colors. I prefer you to use red, green, yellow because we all know what is the meaning of it, like in a traffic signals, isn't it? So don't overthink. 10 to 15 seconds per topic. Your gut feeling is enough. We want a honest snapshot, not a thesis. I'll give you 5 minutes of time. Mark all your boxes in these 4 subjects. Mark all the boxes. Come on. Are you doing it right now? Can I get an answer in your chat box? Are you doing it right now along with me? Are you doing it right now along with me? Yes. Very good. Come on. Yes. So you are seeing the workbook. In the workbook, you have green. You are going to mark it with green, yellow, and red. Now what you are going to do? Now what you are going to do? If you are not doing it right now, no problem. But along with me, pause this video if you are seeing afterwards. And again, you are going to continue this video after completing, marking everything. So now count randomly. In medicine, how many red boxes you have, how many green boxes you have, how many yellow boxes you have. Similarly for OBG, for your pediatrics, for your surgery. You're going to do the same protocol for all 4. Okay, all 4 you're going to do. Write down the numbers. Medicine, surgery, pediatrics, OG, red, yellow, green. Red, yellow, green. You're going to mark like this. And you're going to tell, for example, I have 30 red box in medicine. I have 60 green box in surgery. I have 20 green box yellow and then 40 green box in OBG and only 10 in my red. Likewise, you define it. Let's define what to be done, what can be compressed and what can be safely out. Okay. Are you ready? Are you ready? Now, these are your data, not a vague anxiety. You don't have anxiety now. You have a data where you are lagging. Where is the red signal for you? Where is the green signal for you? Where is the yellow signal for you? You have a lag now. You have a data now with you. With this data, what you're going to do, you're going to analyze it. Okay. With this data, what you're going to do, you're going to analyze it. What you're going to do, you're going to analyze it. So how you're going to analyze it? Let's see. One minute. Yeah. Yeah. So what you're going to do it now? Yeah. Let's define what must be done. What can be compressed here and what can be safely out. So non-negotiable, something which are must to know. I'll give you the important must to know topic. For example, if you take cardiology, heart failure, MI, shock, hypertension, arrhythmia. If you take respiratory, pneumonia, TB, asthma, COPD. And if you're going to take GIT, peptic ulcer, diarrhea, acute abdomen, GI bleed, renal, acute kidney injury, chronic kidney disease, endocrine if you take diabetes and thyroid disorders, CNS if you take stroke, seizures, meningitis. If you see in OBG, PPHC, eclampsia, normal labor, high risk pregnancy, these are very important. Pediatrics when you take neonatal resuscitation, common pediatric emergencies, nutrition, these topics are frequently asked. Life-saving protocols and emergencies. Criteria like Jones criteria, Duke's criteria, Lights criteria, Curve 65, Glasgow Coma scale, Apgar scale, Bishop score, SOFA, and all those score whichever present in your workbook, which is labeled as must to know. And standard operative procedures like appendicitis, hernia, intestinal obstruction, perforation of peritonitis, cholecystitis, cholelithiasis, breast lump, common pediatric surgical problems, everything that is labeled as must to know in your workbook. If it is labeled in the workbook as must to know, if it is labeled as must to know in the workbook, you need to do it. It is a non-negotiable. So this is like the core topics which you are going to study for your exam to pass your exam. Second thing is compressible. We can shorten it. These are compressed now. Like extra reading beyond question can be compressed. Instead of reading the whole Harrison topic or chapter on pneumonia, read the parts which are necessary. Like 2 essay questions, whatever can be asked from there. 80% of value and 40% of time alone you give. and reread the same topic multiple times. Now you know what are the important topics. Read it multiple times. Instead of rereading shock 4 times, read once. Okay. And then use the active recall drill method and read which you are not confident. So something in the red and yellow box. Green box, how many times, how many ever times you read, there is no use because already it is inside your brain. So don't read that again and again. Read the things which are in the yellow and red. And finally, some topics are nice to understand deeply, but they are not exam critical. Example, rare causes of jaundice, unusual presentation of MI. These are not asked in the exam. Why you are going to waste your time in that? For these, one short note is enough. One essay is enough. Don't spend 4 hours. Okay. And then cuttable one. Okay. So this is a permission slip many of you need. If you are significantly behind, for example, less than 50% boxes are only in green color, you have permission to drop or defer the topper's place in that subject. Do them only if you have time and energy left after you are solidly knowledgeable on your must to know topic. Look at your workbook. RN section, which is given in the workbook, is a topper's place. In your current state, topper's place is the icing on the cake. You cannot ice a cake that doesn't exist itself, isn't it? So first you need to have a cake to ice it. So first bring that cake. In January, cake comes first. Icing comes in February. Only if the cake is solid. Only if the cake is foundational. So now you get a new structure that you can plug into reality. From subject wise length, just shift to the system wise. If you are yet to start anything, after your optional ENT and minor subject, shift to system wise manner. Okay, like cardio in medicine, cardio in pediatrics, cardio in surgery. Likewise, go in system. Okay, we are going to organize by system because systems are how clinically questions are asked. Seeing a topic across subjects like shock will be there in medicine, shock will be there in surgery, shock will be there in pediatrics. This reinforces the understanding and breaks the monotony. So what we will do exactly is, we will make it as 7 blocks. Okay, we will make it as 7 blocks basically. Block 1 is cardio and respiratory system. Take 5 days. But in this, you're going to complete cardiology from your medicine, cardiology from your surgery, that is your chest, and cardiology from your pediatrics. Everything you're going to cover in this time. Okay, we are going to go by system wise. So you're going to cover everything in this 5 days. Next 5 days, I'll give you block wise timetable. Now that you are going to the block wise, I'll give you block wise timetable also. So GIT, hepat and nutrition. Block 3 is going to be CNS and psychiatry. And then block 4 is going to be renal and acid balance. Block 5 is endocrine and OBG. I'm giving you 5 days. Endocrine is 1 day, 4 days for your OBG. And block 6 is all the emergencies and trauma. And block 7 again revision. So this is separate. So up a total days, you just count 4, 5, 5. Then here you're going to have 2 days. You're going to have 4 days. And you're going to have 4 days. Up a 5, 6, 7, 8, 10, 15, 20, 24. So just 24 days you need. So yesterday I got a call, sir, I don't know how to start, sir. What I'm going to do, sir? You don't have to do anything. Just 24 days is enough for completing. So now you are given 5 more days. In the 5 days, Opthal, ENT, psychiatry, derm, radio, all your shorter topics, anesthesia, that you cover. After that, 24 days you take. So total timing is 29 days. So today is 2nd. If you start from tomorrow, you can complete it on February 2 or February 3. March is your exam. So you have an ample amount of time to cover. So now your anxiety you can leave because now we have sorted out how to cover the topic. How to cover the topic, isn't it? Now we have sorted out how to cover a topic. So you don't have to worry about it. So now most of you are in leave. Most of your models are over. If at all your models are not over, please, please, please don't go in depth into your models. Now we need to cover first entire thing. Then we will go for models. Okay. Daily we have a workbook. I'm sending you every day. So what you're going to do is morning session. You do, if you're going to follow this timetable, already those are following that timetable, fine. So if you're going to start with refine part, or if you're going to, you have completed revision and then you're going to move into second part, whatever it is, you're going to follow this. Morning, you're going to go for 3 hours continuously. You're going to sit, start at 9 o'clock, end at 12 o'clock, 3 hours concentrated. You're going to sit. So morning session, topic 1, or essay from medicine, like MI management, stroke, DKA, pneumonia, whatever it is. And then second topic, one surgery or OBG topic from the same system. And then one from pediatrics topic. Likewise, 3 essays you complete. Okay, use the question first skeleton first method from the session 4 where I have discussed about it. And end of each with 2 to 3 minutes of active recall. Close your book, write the heading from memory. And afternoon session, again you have 2 hours. So 12 to 1, take a lunch break. Take a lunch break. Okay, after 1 o'clock, 1 o'clock to 3 o'clock. Okay, so 1 to 3 p.m. what you're going to do? You're just going to pick 6 to 8 short notes like Duke's criteria, JBP ways, cardio enzymes, atrial fibrillation, acute coronary syndrome classification, and then another 15 to 20 minutes. So first you take over 2 hours. Adu pinna. Okay, or 3 to 4 p.m. what you're going to do is you're going to write the criteria. Okay, images, all those things you come in the 3 to 4 session. Okay, so you'll have 4 o'clock, then 4 to 5 p.m. take a break. Okay, take a break. And what you're going to do is 5 o'clock to 7 o'clock, you're going to again take the third one. So again, you're going to take 3 essays. Okay, so 3 essays you're going to take and 5 to 8. Let's keep it as 5 to 8 p.m. You're going to do 3 essays. Similarly, 3 to after completing 3 essays, 8 to 9 p.m. You're going to do MCQs. You're going to do MCQs. So review the hardest 3, whichever you have felt that day. Why did you miss them? Analyze it. What pattern triggered you up? Analyze it. So daily timing, if you're going to see according to this, you have 3 hours. Here you're going to have 2 hours and the 3 hours are okay. So you're going to have 3 hours. Then here you're going to have 3 hours. So 9 hours easily you're going to sit. Have adequate chocolates with you so that you don't get hypoglycemic. Now use the color coded audit you had done to customize. For green topics, do only active recall, no rereading, move fast, and these are the maintenance topic. You're going to have a maintenance topic. Then second one, if it is going to be in yellow, one good read with a question-based approach you're going to do. Red topic, sit it with that, prioritize that, read the full question first, and then spend full 20 to 25 minutes, then active recall method. Now, I have addressed the emotions head on because knowledge without emotional reset is going to be very difficult, isn't it? So most of you by now will be thinking, I am so far behind, sir. I can never cover everything. My exam is lost. Here is the truth. Even 40 to 50% of solid topics done well, you carry 60 to 65% of success in your exam. And 60 to 65% is a pass with reasonable confidence. You will have a reasonable confidence. So the question is not, can I cover everything? You are not aiming at 100%. You are not aiming a 100% result. The question is, can I cover that 40 to 50 topics which Raghu sir has shared effectively? If you ask me, 6 weeks is more than enough. Now you are shifting from cover everything to score maximum mark, secure maximum mark. Okay, this is was done in December, but now it is January. Now you want is a depth in high yield topics and maintain a coverage in others. You are shifting from I study every topic equally to I must know the must to know topic beautifully. Then you're going to adapt minimum viable day. On rough days, like from family issues there, like your mood symptoms are there, you don't abandon the day. Instead, no matter how hard is your day, at least one must to know topic which contains 2 essays or 3 to 5 short notes and 10 MCQ. That's it. Otherwise, if you have a problem, just solve my own mock test which I have shared. If you are very bored, try to solve the mock test. Judge yourself weekly, not daily. Don't judge yourself daily. Today I am behind, I am useless. Tomorrow I will work 12 hours to catch up. Don't do this. Ask yourself, how many must to know topic did I secure this week? Did my MCQ accuracy improve? Did I reduce my red boxes at least in one subject? And did I maintain the green box with 2 minutes drill? Weekly assessment is much kinder. It smoothens your daily functioning. If you had a bad day in Monday, but a great day on Wednesday and Thursday, your day is still positive. Your week is still positive. Day-to-day judgment is going to destroy you. Weekly judgment will be the one which keeps you intact. So now, close your eyes, close your eyes, and then imagine what are the problems you are facing. For the first 7 days, here is what you will be doing. Complete the green, yellow, red audit. So you're going to do green, yellow, red audit. You're going to do that. Clear? You're going to do that. Okay, you're going to do that because that is going to be your roadmap. That is going to be your data. Pick up one system from the block. For example, cardio and respiratory. Okay, your mission, your goal has to be convert all the red boxes into at least yellow box and convert all the yellow box into green box. Morning 2 essays, afternoon again essay, evening again essay. You follow this. You follow this. This is what you're going to follow. And you're going to follow this for 7 days. You're going to follow this for 7 days and tell me. Promise me now. Promise me now. Because I'm doing it at free of cost. And what I want you is to promise me. What do you want to promise? You want to promise if one system can be rescued in 7 days, you can rescue the whole syllabus in March. Okay, whole syllabus in March. How many cardio and respiratory topics are green? Did MCQ accuracy improve? Try to re-ask you all this again and again. You have not lost this exam. You have just lost the version 1 of the timetable, and today I have installed you version 2. Now prove to yourself in the next 7 days that version 2 is a real works. In the real life, it is working. Doctors, you have a choice right now. Choice number 1 is take guilt. Feel bad about December. Believe that you are beginning lose motivation, spiral into anxiety. By mid of February, you will be in crisis mode. That is not at all fun. Or choice number 2, accept, reset and execute. Forgive December. Install version 2. Run the 7 days challenge after completing your ENT, opthal and your minor subjects. By mid-February, you will be on the upward trajectory. So you will be going like this, upward trajectory. You will be ready. I know which one I would choose. Okay, I know which one I would choose. But let me see who you're going to choose. Okay, definitely next session I will be conducting where we will focus on final 4-week peak plan and integrated full paper practice. Okay, I'll give you that. But that depends on how you are running this 7-day challenge with honesty and discipline. So here is my task. For 7 days, don't study like a student worrying about everything, thinking that they will fail, they will fail, they will fail. Study like a clinician who reset the plan and is now executing it with precision. Prove to yourself that rescue is possible because it is possible. And that's what I wanted to highlight to you. Thank you so much, doctors. We will meet you in the next session as a strategic, reset and ready version of yourself. I hope that you will be joining with me again in a full energetic manner. Full energetic manner. Clear? Clear, right? Yes. So if you have any more doubts, any more things, you can just put it in the chat box. I'm ready to answer it. I have got numerous questions, and with that in my mind, I have done that today's session. I have done that. Okay. So again, repeat along with me. You have not lost this exam. You have just lost the version 1. You still have lots of time. You will be able to do it. What? You will be able to do it. Thank you once again. Thank you so much. And I hope that every one of you is going to pass this exam with distinction, with colorful honors and medals and everything, because the effort that I make is just to see you guys happy, see you guys successful. And I hope that that success, you will all get it for me. Your success is my responsibility, as I already told in the day 1. And your success will make me happier. And that's why even after a duty day, even after hectic duties, I make sure that I'm interacting with you guys. So thank you so much. Hope that you all will follow the timetable. You are always welcome to message me because I have been answering every single message that I get. Definitely, I will answer again also. So whatever doubt at any point of time, message me, ping me and keep. I will definitely see when and reply it when I am free or when it is possible. Okay. Okay. Now your mood has to be like Arjuna Reveal song in Gilly. It should be like a rapid song. So you will be like getting that feel, right? So that feel you should get right now. Okay. Will you get it? Will you get that feel? I want every one of you to get that feel. Will you get that feel? Can you put it in the chat box? Can you put it in the chat box? Will you guys get that feel? Will you guys get that feel? Sir, I'm following a schedule. Some topics I'm forgetting. Don't worry. Don't forget. That's why I'm telling. Don't forget and all. So it's like you should never forget. Okay. So now you should have this version. This version you should have now. You have to have this version. Okay. You should run. Like Vijay in that movie, you should run. Okay. I want each and every one of you to run and secure success. Okay. So I'm ending it with this motivational song. You are going to succeed in this exam. There is no other choice for you guys, but take it easy. Take it like very jolly, because at the end, we are just writing an exam. We are not going to take a life decision. This is not a life decision anyway. You will definitely succeed. Okay. Thank you.